So Lisa brought her Bernese Mountain dog, Lexie, to me just a couple of 2.5 months ago. The dog was only 4 years old, but had been diagnosed with a brain tumor. And actually, it's very interesting. The symptoms presented initially just with some coughing. The dog had no problems, but it was coughing. And they decided to put it under anesthesia and get an x-ray of its chest to see what was going on. And there was some, what they diagnosed as aspiration pneumonia, but after the x-ray and the anesthesia, the dog developed a head tilt. Then they were very suspicious there may be something worse going on than just aspiration pneumonia, and the dog underwent an MRI, again under anesthesia. And after it was confirmed it had a nickel-sized brain tumor on the right side of its brain, but after this test, the dog's doing very, very badly. Its head tilt was worse. It wasn't eating well, and they basically said it was inoperable and there's nothing they could do, and they gave the dog no more than 2 weeks to live. That's when she sought my help. And my heart really sunk. I mean, I understand the need of wanting to do tests, but unfortunately, so many of these tests that have to be done under anesthesia, especially when the animal has cancer, can have disastrous effects. And this was just what we're seeing with Lexie. I started the dog on a remedy for the aspiration pneumonia, which is what the presenting sign was, and it cleared up actually completely. And then we started addressing the underlying tumor, which was the causation of the dog ingesting food into its lungs while it was eating. And it's 2.5 months later, and the dog is better than it was when she came to me.
So first diagnosed with acid reflux because she was drooling, and then pneumonia, and she had a weird way of walking.
And this was in August or
this
July?
was in July,
okay.
The end of July,
Okay.
and she was walking wrong. The vet, when we took her to the emergency vet, they said that they diagnosed the pneumonia, and they didn't see any problems with her neurologically, but they said if you wanted to explore it, to see their neurologist.
Okay.
Which, after trying to figure out, now she had a head tilt after being put under for the x-rays.
So after the anesthesia is when
After
the
the
head tilt started.
Correct.
So she had no head tilt before that.
No,
Got it. Okay.
she didn't.
Yep,
The anesthesia brought out a head tilt.
Right.
So we eventually, it led us to the neurologist, who suggested the best way to diagnose her would be an MRI.
Okay.
And with the MRI, they discovered the brain tumor.
Okay. And how did she do after the MRI? Did the brain tilt get worse at all? Or?
Yes, the head tilt
Yeah.
was worse. She was more off balance for several days.
So let me just explain why that happens. It basically, any anesthesia suppresses the immune system, and any cancer that's there can kind of activate. It gets worse. It can actually get worse. I mean, obviously we can't get a definitive diagnosis without some kind of test in terms of, if there's a brain tumor, what size it is, but it's always a risk doing these invasive procedures. Okay, so basically they told you what was the prognosis for her?
He couldn't determine what type of cancer it was, and he says depending upon the type that it is, she had a prognosis of 1 to 2 weeks, or
Of life.
or 2 to 4 months.
Wow. Okay.
And, yeah.
So considering it's 2.5 months now,
Right.
she's doing better than she was before.
Yes.
So we would
She's-
say that they are incorrect in their assessments, at least with the fact that we're using holistic medicines to help her.
Yes.
I mean, maybe doing nothing, she would have had that little bit of time, but 2.5 months later, she's better than she was 2.5 months ago.
Yes. And they also sent me home with the prednisone, which I think brought back the pneumonia that they said had cleared up, because they x-rayed her lungs while she was under as well. And they said the pneumonia was gone, but it seemed to have come back.
Due to the prednisone.
Prednisone, yeah.
Okay. And she's off the prednisone now.
She's
right?
she's
no
no
longer
longer
on
on.
Should she still have the right-sided head tilt, or is that gone? Cause
No, I haven't noticed any head
no
tilt.
head tilt. That's great.
No.
That's great. And that aspiration pneumonia had kind of flared up, and you had her kind of rattly cough, correct? Then we gave her a couple of doses of bryonia, homeopathic remedy for breathing problems, and that cleared it up. She was really great.
Yes.
She had poor appetite and low energy, and that got better as well. Yes. So yeah, it's important in cases like cancer, as I was explaining before, that we have to chase the symptoms. So as symptoms change, we have to change the remedy. So, I am hopeful that we're going to get 3 years more from this dog at least, because that's generally what I'm able to have with brain cancer. Cancer actually responds better than even skin allergies. So as we see, she has responded to every remedy that we've given. We're never going to make the tumor go away, but we're able to control the symptoms and make her feel good so she has good quality of life and hopefully many more years than they predicted for her. So along with treating the cancer, the beauty of homeopathy is that we treat the whole dog. So as we treat the aspiration pneumonia, that particular symptom, we're also working on the tumor and hopefully keeping it in remission and even sometimes shrinking it. So as I recommend the sulfur for the cough, which you said has gotten better, she was coughing again and you gave her the sulfur.
Yep, and it gets better when you get the sulfur.
But that and that also is working at the cancer at the same time, which is really nice. How's her appetite?
Her appetite's been good.
Good.
It's been good. She seems even actually, she's been begging. Too,
Begging.
so,
That's
yes,
great.
she's begging.
Considering
It is great because we're like, oh, we haven't seen
so when
that
you
in
came
so
to
long.
me, right,
Yes.
you came to me, she wasn't eating well. So
She
the fact
was
that she's
not.
begging, that's great. Because we talked about quality of life, number one, is the most important thing.
Yeah.
And I will say that I don't necessarily eat all the best things that are great for me, but I think that we need a little happiness now and then. So eating ice cream, although it may create phlegm, if it makes me happy, that's okay. It seems like she hasn't lost any weight,
No.
is that correct?
Yep.
Her coat looks,
She's
she looks
good.
great. She's
She does look
smiling,
great.
she's happy. So her energy is good. She's going up the stairs. She's not restless. She's not following you around anymore. Is she going for walks? Happy to go
Yep.
for walks?
She loves to go for
Playing?
walks.
Does she play?
Yep, she plays. She
plays?
does her squeaky toys.
So is this your old Lexie?
This is our old
This is old
Lexie, huh?
Lexie. I mean, she's
Yeah.
playing, she's happy, she's eating. So I never like to put limitations on everything. I mean, every day is a gift, and we want to appreciate and love every day. But I think it's very unfair for anybody to put a time limit and say you're going to be dead in 2 weeks or 2 months or anything. I mean, we know we have a serious problem here. I mean, I've been living day by day with my dog's cancer for the past 10 or 11 years, and I stopped keeping count, but she's 10 or 11 or 12. But it adds up. So we just want to make every day the best and hope for the best, and hopefully we'll get there. And it's completely realistic. So I'm so happy that we passed the 2-month mark. Number one.
Yes.
Okay. Is there anything else about her that?
Her ear. This
Okay.
ear
Is that
red.
new?
That's been going on for a little while. I think I talked to you about it.
Okay. I did not
It's
see it
kinda-
with her last
No,
time, right?
I don't think you
Okay.
saw it
Let me
last
just have a
time.
look there. Is she itching at that?
No, she doesn't seem to. At one point she'd flop her head.
Did
Like
she ever
shake her
have an
head.
ear infection before?
She had when she was a puppy.
A puppy.
She did. Yep.
Okay, so just so that you know, I mean, we may have talked about this the last visit. Discharge is the way the body detoxes itself. And it's very interesting. She has a right-sided brain tumor, and it's discharging from the right side of her head. So it's actually the body ridding itself of toxins. It's actually a good thing.
Okay.
In Western medicine, it's a good thing. I mean, we don't want it to be there. We want to clear it out naturally. But one of the mistakes that Western medicine does is to suppress discharges and put antibiotics in the ear, and that would actually make the tumor worse. Just like the anesthesia made the tumor worse, so would antibiotics in the ear make the tumor worse. Even though it seems like they're two separate systems, you go to a neurologist for one problem and an ear, nose, and throat doctor for another one, they are absolutely related. And that is, one of the premises of holistic medicine, that we're all connected. So I actually like the fact that the right ear is discharging and having return of old symptoms, having symptoms that came back in the past that were suppressed by antibiotics. She did have antibiotics in the past, correct? Okay, the fact that it's coming back again, is the first time since she was young that it's coming back,
Yep.
is a good sign.
Okay.
So sometimes things are different than they appear. We want to totally clear this up, but in a natural way.
So we've far surpassed the 2 weeks that she was given as a life-death sentence, basically. The dog is running, it's happy, it's playful, it's doing great. It's not coughing. I have treated many, many brain cancers and brain tumors, and I am hoping that Lexie does as well as the majority of dogs that I've treated and lives at least another 3 years. I hate to put limits on animals, but in general, they come to me when they're probably 10, 12 years old. We've gotten them living to 16 years old even with brain tumors.